It's fair to ask, Dr. Paul, what do you do differently? First of all, I offer a complimentary strategy session online to really hear you and how you want to define your goals. They're not my goals. I have no expectations for anybody. They're your goals. And what are the obstacles in the way of overcoming those goals? Across the years, I've talked to people about having some success of transformation, and they want to list 15 other things that they want to work on. Those are symptoms, okay? If they're in the way of what you want to create, let's work on them. If they're not in the way, then don't use them as a way to delay making the hard choices to create what you want. If you choose to work with me, we'll schedule a 2-hour session online to transform the problem at its root cause. Now, why 2 hours? A lot of sessions, normal sessions, about the first 10 minutes, it's about greeting and pleasantries. The last maybe 10 minutes or 15 minutes of a 45 or 50-minute session is about what's going to happen between sessions and scheduling and so forth. So there's about 20 minutes of real talk time in the middle. And that way you got to have a 3 or 4 or 5 sessions to get an hour and a half of work. I figure people want to get over as quickly as possible, solve the problem, and so we'll schedule a 2-hour session. And for many people, that 2-hour session takes care of the majority of the problem. If it doesn't, then we can meet some additional sessions because we want to solve the problem. All your sessions are uniquely designed around your needs and your situation to get the fastest result possible. You will experience additional transformations that may at first look like they're not totally related to the initial core issue, but they all seem to be tied together. And you'll do that without additional homework, and you can do it without additional long hours listening to audios, and you can just go on with your life. My goal is to help you remove and delete emotional triggers that hijack your success. Rather than giving you more coping skills or logical suggestions that leave the triggers in place and risk relapse back into the problem. For most of my life, until 5 years ago I began to learn about it, all the helping professions assumed that old trauma responses that were learned at an earlier age are hardwired in our brain. When it's triggered, again, a neurological system is triggered outside our conscious awareness, it wins. And so we add more coping skills. And then we added some competitive skills. So let's add meditation, prayer, affirmations. Let's add cognitive behavioral thinking, or get our thinking straight. We just get our logic straight, our left brain straight. Then we could compete with this emotional side over here. However, it left it intact. Now we know this is a process to delete and remove old learned trauma responses without the risk of relapse. That's a huge deal. It's no longer dealing with the symptom. It's about dealing with the root cause. And so if you're at a threshold, if you believe something needs to change, and what is to change now? And it's me, and you're ready to do that, then I offer a free strategy session. You can sign up at pauldfitzgerald.com. Let's look at it. Let's decide how we can move forward, and let's transform the life that you have into the life that you really want to create.